Effects of Metyrapone in Patients with Mild Hypercortisolism by Mussolino et al. Mild hypercortisolism is associated with increased cardiometabolic risk and consequently increased risk of bone frailty, diabetes, hypertension, thrombotic events, infections, mood disorders, and mortality. Metyrapone is an adrenal steroidogenesis inhibitor which reduces cortisol production. Its clinical efficacy on blood pressure, glucose metabolism, and cortisol circadian profile alterations, however, is still to be investigated. The aim of the study was to evaluate the impact of low-dose evening metyrapone on 24-hour ambulatory BP, glucose metabolism, and cortisol circadian rhythm in patients with MH. 20 patients with MH were treated with evening metyrapone at a dose of 250 to 500 mg per day for 24 weeks. BP control, glucometabolic profile, and salivary cortisol rhythms were assessed at baseline, 12 and 24 weeks. At 24 weeks, 40% of patients achieved a predefined clinically significant BP improvement. This effect was more pronounced in the 6 patients with an elevated baseline systolic BP. Glucometabolic control improved in 4 patients, notably in those with type 2 diabetes, with a reduction in HbA1c of greater than or equal to 0.5% in 2 patients without changes in anti-diabetic therapy. Metyrapone was well tolerated, with no adverse events or adrenal insufficiency reported. Metyrapone showed a clinically meaningful reduction in systolic blood pressure in 40% of patients without intensifying antihypertensive therapy. This study informs future strategies for managing endocrine-related cardiovascular risk in non-surgical patients with MH. To read more, please scan the QR code or use the link provided.